Good morning. Thank you for coming to the in-service on ticks and tick-borne diseases. Today is April 25th, 2022, and Evan Moore is going to be presenting. It's all you, Evan.
All right. Thank you so much. Just wanted to thank everybody for coming out today, for tuning in. My name is Evan Moore, and I'm a fourth-year pharmacy student at Campbell University. And today I will be talking about ticks and tick-borne diseases. So super fun stuff. By the end of this presentation, you'll hopefully be able to list the types of individuals that are at the highest risk of suffering a tick bite, as well as describe the different species of ticks that inhabit North Carolina and any diseases that they can transmit, and discuss the pharmacological and the non-pharmacological treatments and preventative measures that we can use in the instance that you experience a tick bite. So let's get into it with a little bit of tick statistics, as I like to name this. Lyme disease is kind of the big one that we tend to focus on with ticks. And the good news is that it's not nearly as prevalent in North Carolina as it is in like the mid-Atlantic states. You can see here on this 2017 version of the map that there's quite a bit of occurrence in those mid-Atlantic states up in the Northeast. You can also see that the cases of Lyme disease have nearly doubled in the 15 years between 2002 and 2017. And we're actually spending about $1 billion a year. As Lyme disease spreads to new regions, we're spending a lot of money trying to treat this disease. So definitely something to pay attention to. We'll talk more about Lyme disease in a minute. We'll talk about the tick that can transmit it, and we'll talk about ways to treat it too, as well as other diseases. So I also wanted to go over the life cycle of a tick. Ticks, as you may or may not know, are going to feed on the blood of their hosts, which are usually going to be animals that can vary in size, even lizards too. They're going to feed on the blood of their hosts at every stage of their life. And they start off usually in the springtime when the adults lay their eggs. And then they progress into larvae in the summer through the fall and the winter, where they become nymphs, which are kind of like the adolescents, I guess you could say, of the tick world. Before progressing into adults. And in this kind of time period, the risk for human infection is going to be greatest, especially because it kind of falls in the spring and the summer months. And these are the two biggest months. So I'm kind of glad I'm giving this now, because we're definitely getting into these months where ticks are going to be really prevalent. And so hopefully the information that I'm going to give you today can help you prevent potential bites. Some of the major risk factors for getting a tick bite are going to be camping or hiking, especially during the spring and the summer months, as well as working or playing in wooded or grassy areas, owning pets that are outside on a regular basis, tending to gardens, and even living in the mid-Atlantic states like I had previously mentioned. Now, there are still black-legged ticks, which are the ticks that transmit Lyme disease. They do still exist in North Carolina. They're just much less of an issue, but it's just something to be mindful of. And you're always going to want to make sure that you take the necessary precautions, which I'll also discuss in a minute. But for right now, the biggest risk factors are just going to be just being outside for any extended period of time throughout the day. So if you're a construction worker or something like that, or you're definitely at a higher risk. So now we can get a little bit into the ticks that exist in North Carolina, starting off with the American dog tick, which is going to be active in the spring, the summer, and the fall. It does live along woodland paths, as well as in recreational parks and farm pastures, wastelands, and other shrubby habitats in rural and suburban areas of North Carolina. The adults are going to prefer humans and dogs as hosts, which is kind of where it gets its name from. And in North Carolina and kind of throughout the Southeast US, the American dog tick is going to be the tick that's responsible for transmitting Rocky Mountain spotted fever, but it does not, and I wanted to repeat, it does not transmit Lyme disease. So that's something to take note of. It is found throughout North Carolina, but it is most common in the Piedmont area. Next is kind of the more unremarkable of the four main species. It's the brown dog tick. They occur throughout North Carolina and can be active year-round. In all stages of their life, they feed almost exclusively on dogs, and they very rarely attack people. But they can lay their eggs in masses in cracks and crevices along like building foundations, as well as in pet kennels, and even your home if you happen to miss one. So after a few weeks, you may wake up to find several thousand larvae or the children kind of climbing on your walls and your draperies. So not very pleasant, kind of the stuff of my nightmares, if I'm going to say so myself, but definitely interesting. But it's more of an unremarkable tick just because it's not really known to transmit any of the major diseases. However, the next one is going to be the Lone Star tick, which all stages of the Lone Star tick are going to readily feed on people and large wild or domestic animals like deer and dogs. Adults and the nymphs or the children are abundant in the spring and the summer months, and the larvae or the babies of this species, which are commonly called seed ticks, are really, really abundant in the fall. So in this stage, the Lone Star tick readily attacks humans. It is found in habitats that are pretty similar to the American dog tick, and bites from this tick can result in an interesting illness called STARI, which stands for the Southern Tick Associated Rash Infection, which essentially just starts off as a rash that's pretty similar in look to Lyme disease, but it is not caused by the same organism as Lyme disease, and it's not linked to any of the sort of neurological and cardiac problems that Lyme disease can cause. The Lone Star tick also transmits a bacteria that can cause ehrlichiosis, which is a really funny word, really big word, and we'll talk about it more in a minute, but it is one of the transmitters of the bacteria that can cause this condition. And this particular tick is going to occur predominantly in the coastal plain, but it can also be found in the Piedmont region of NC as well. Really interestingly and kind of terrifyingly, there's recent research that's also tied the Lone Star tick to something called the alpha-gal allergy, which is where the tick bite can result in you developing an allergy to mammal meat. I had never heard of this until recently, and I've included a link in my references page. Like really the entire references page are just kind of links that you're absolutely welcome to use for any additional supplemental information. But I went ahead and threw a link in there to the CDC's page on the alpha-gal allergy. It's a really interesting read. So take the proper precautions and prevent that from happening for sure. And then lastly, we have the black-legged tick. Which the earlier stages of this tick feed on lizards and small mammals. And the nymphs and adults attack small and larger mammals, including dogs and deer. The adults are going to be active in the late fall and in the early spring, and also in the winter when the temperatures are going to get above freezing. The black-legged tick is going to be found in the same habitats of NC as the Lone Star tick, and it is the vector or the transmitter of the bacteria that causes Lyme disease. So this is kind of the big one that we really want to pay attention to, is the black-legged tick. Now we can kind of get more into those diseases that I mentioned earlier. So Rocky Mountain spotted fever is also known as tick typhus, and it's caused by a bacteria-like microorganism called rickettsia. And this microorganism is acquired by an American dog tick when it takes a blood meal. So it feeds on an infected animal. These bacteria are not normally infective to wild animals, but they are extremely pathogenic, meaning they're very, very capable of causing disease to humans and dogs. Rocky Mountain spotted fever is normally a disease of wild animals, like I previously mentioned, but people can be infected while they're camping or hiking in tick-infested areas, and if they're bitten by an infected tick. On top of this, pets, your outside pets can also carry an infected tick into your family living room. And the disease organisms can also be passed through the egg of an infected tick and from life stage to life stage in the tick's life cycle. So it can persist. Fortunately, though, only a small percentage of dog ticks found in nature are infected. But symptoms to definitely pay attention to can include headache, fever, chills, aches, pains, and sometimes nausea. And these symptoms are usually going to be accompanied by a rash that starts around your wrists and your ankles. So a person showing any of these symptoms between 2 to 14 days after they get bitten by a Lone Star tick should really consult a physician at once, like as soon as possible, because early treatment with antibiotics can prevent severe illness. In some rare cases, Rocky Mountain spotted fever can even cause death. So the earlier that we treat really any of these diseases with antibiotics, the better off you're going to be, and the less chance there's going to be of long-term complications. The second one that I had kind of talked about before is that big word ehrlichiosis. I got a pronunciation there just to try to help you out a little bit. But it's just a general term that's used to describe diseases caused by a bacteria of the Ehrlichia family. This disease is really going to occur primarily in kind of the southeastern and south central regions of the country, and is, again, transmitted primarily by the Lone Star tick. People with this condition will often have like fever, chills, headache, muscle aches, and sometimes upset stomach. So there's going to be some overlap with the symptoms, especially something like the fever and things like that. And lastly, we come to the big one. We come to Lyme disease, which is transmitted through the bite of the infected black-legged tick. And this disease is really going to be prevalent in the northeastern United States, where this particular tick is the species that's going to be responsible for its transmission. Again, that's kind of where the black-legged tick is mainly located. The black-legged tick in the southeast doesn't tend to bite humans nearly as much. So as a result, which is good for us, there's typically many fewer cases of Lyme disease that are found, especially in North Carolina. But it has been divided into 3 clinical stages, where stage 1 is going to kind of involve a rash and flu-like symptoms. And within 30 days of infection, this kind of characteristic rash forms around the site of where the tick bit you. But interestingly enough, 20 to 30% of Lyme disease patients don't have this rash, or they don't show this rash, which kind of delays the diagnosis of this condition and can result in patients getting sicker and progressing into later stages because of this. The rash can occur as an irregular kind of red blotch, or it could consist of a bright red ring around the bite that kind of expands over several days to form a bullseye pattern. So this is kind of a characteristic symptom and is an identifier of Lyme disease. The rash is usually accompanied by fatigue, headache, stiff neck, muscle aches and pains, and just an overall general feeling of discomfort. If it's untreated, it can progress to stage 2, which occurs over the next several weeks, and it can include cardiac and neurological symptoms. These neurological complications occur in only about 15% of patients, but they can involve encephalitis, which is inflammation of the brain, radiculitis, which is inflammation of your nerve roots, and even Bell's palsy, which is partial facial paralysis, which you can often see in like stroke patients. In most instances, these symptoms are going to completely disappear, but they can persist for several months before they do this. Cardiac abnormalities like heart palpitations only occur in about 8% of patients, so they are pretty rare alongside the neurological complications. But symptoms of stage 2 are going to mainly include dizziness, shortness of breath, and those heartbeat irregularities that could even be bad enough to result in the installation of a pacemaker. Within several weeks, again, though, these symptoms are usually going to disappear. And lastly, we have stage 3, which is really kind of characterized by arthritis-like problems that can appear up to 2 years after you exhibit that rash from stage 1. Patients can experience pain, swelling, and elevated temperature in one or more of their joints. Some patients can also show sleepwalking, as well as loss of memory, mood changes, and an inability to concentrate. But Lyme disease and its complications, kind of like the other 2 main diseases, can be treated with antibiotics, and treating as early as possible has been clinically proven to reduce the duration of the disease and reduce your chance for late complications. So how do we prevent tick bites, and how can we protect ourselves from acquiring these diseases? Well, the biggest thing, which may not be possible for some people, again, if you work outside, it may not be a feasible option, but avoiding wooded or grassy areas altogether whenever possible is going to be the easiest and probably most effective way to reduce your chance of getting bitten by a tick. But if you are going to go out and hike, if you're really passionate about hiking, or if you're working again outside, you can do what's called dressing defensively, which is where you're basically going to cover up with long sleeves and pants when you're hiking during spring and summer months. You can wear a hat that covers your ears and your hair, and you can also wear light colored clothing that's really going to help you identify if ticks are on you easier. You can also use repellents. I know there's been some controversy surrounding DEET, which is going to be found in basically your run-of-the-mill insect repellents like off. And you can get these in different percentages. From like, I think as little as like, a 5% up to 100% DEET. Um, but DEET has been proven to be effective at repelling ticks, and there have been numerous studies, especially recently, that have proven that DEET is pretty much completely safe to apply, but it can be irritating to your skin. So I usually recommend people apply DEET to their clothing in areas that I like to kind of call hot zones on your person. And these hot zones are going to mainly be your socks, the armpits of your shirt, and even the waistband of your pants, because these are all areas that ticks tend to accumulate if they get onto your person. So these are great areas. You can spray your hat as well. That's a great thing to do because ticks love hair. They love kind of the more like moist environments on your body. So again, like the armpits and things, and they love to kind of gather in your hair. The next big thing, which that's kind of a good segue into my next big point, is going to be checking everywhere on your body, even checking your pets, especially if they're outside. If you have a dog that's, outside, or if you take them on walks every day, you always need to shower after your exposure to any areas of potential tick infestation. And you should check your entire body using a mirror, or even have a partner check them as long as they're okay with that. Make sure to wash your pets and check them as well. Again, sometimes pets can just bring infected ticks right into your living room without you even knowing it. And lastly, something that a lot of people may not know about is creating a tick safe zone in your yard. Keeping your yard well maintained, so raking up leaves and things like that can help kind of prevent areas that ticks can hide in your yard. And you can also discourage the presence of deer through setting up barriers or removing plants that could attract them. Because kind of as I previously stated, deers are one of the biggest carriers of infected ticks in the US, especially in North Carolina, because we seem to have a limitless supply of deer. So next up, I wanted to cover the proper tick removal method, because there is one, and it's extremely important that you know how to effectively remove one. You want to start off by using clean, fine-tipped tweezers to grasp the tick as close as possible to the skin surface, and you're going to want to pull upward with a steady, even pressure. You do not want to twist or jerk the tick, because this can cause the mouth parts of the tick that are embedded in your skin to break off and stay in your skin. And if this happens, you can always try to remove the mouth parts carefully with a set of with the tweezers. But if you can't remove them, you can just leave it alone and let the skin heal. And it should kind of over time push those mouth parts out of your skin, because it's a foreign object and your skin will treat it as such, or at least it should. After you remove the tick, always thoroughly clean the bite area with rubbing alcohol or soap and water, and then always wash your hands as well. Never, and I repeat, never crush the tick with your fingers, especially when it's attached to you, and always dispose of a live tick by either putting it in alcohol or flushing it down the toilet, or if you are worried about getting infected or contracting one of the diseases, you can store it in a plastic Ziploc bag and leave this in the fridge or the freezer to submit it for testing, because your doctor can perform tests on this and see whether the tick was a disease carrier or not. And a point that I really wanted to kind of reiterate is, if some patients may have heard more old school methods for treating ticks, and those methods may involve telling you to paint over the tick with nail polish or petroleum jelly, which can maybe cause the tick to suffocate and eventually fall off your arm. Well, don't do this. Absolutely don't do this. The longer the tick sits on your skin, the higher chance you have of it transmitting infection if it is a carrier. So your goal is to get that tick off of you as quickly as possible. So why is removal important? Well, first of all, this is a picture from the CDC that's just a really great picture of how you want to be removing these ticks. As you can see, they've gripped the tick right next to the head, up against the skin, and they're pulling straight upward to get all of those mouth parts out of your skin. So the method that I just told you about, that's outlined in this picture, is going to be the best and most effective way to get all of the mouth parts out of your skin and avoid leaving them still embedded, which can increase your risk of infection or even or irritation. Extracting close to the skin is going to help avoid squeezing that tick, because if you squeeze the tick when it's still embedded in you, it can expel the contents of the tick back into your skin, which can lead to disease transmission, again, if that tick is a carrier. And if you are concerned about infection or anything like that, or if you show a fever or a rash within a few days to a few weeks of being bitten, you absolutely want to follow up with your doctor, with your pharmacist, with somebody, a medical professional, and you want to tell them when the bite occurred and where you most likely acquired it, because giving them any information that you can is going to help them possibly determine, if you have an illness or not. And really interestingly enough, there are kind of newer devices that are developed in the last, decade or so that help you easily remove ticks if you maybe can't effectively use tweezers, or maybe if you struggle to use tweezers, or if you have trouble seeing. These devices are really great. They can be used. The one on your left here, the tick twister, can even be used on your pets as well to safely remove the ticks. You can just slide the device over the tick around the mouth parts and kind of use that same upward pulling motion to extract the tick. I've heard really good things about these. They have great reviews on Amazon, and they're only a couple of bucks. And a lot of times with the tick key on the right, you can just keep it on your keychain so that you can always have something on your person to help remove the ticks, especially since a lot of people don't really tend to carry tweezers on them. So if you do contract a disease, there is treatment for them, which is great. Antibiotics are going to be the main course of treatment for the diseases, but they're only really warranted if the risk of the infection is severe. In this case, it's mainly going to just be if you're displaying those kind of hallmark symptoms, like if you have a rash, if you have a fever, things like that. If they're really concerned for infection, they're going to give you antibiotics, because in a lot of cases, they're going to be required to prevent the disease from progressing. Doxycycline, which you may have heard of before, is the first line therapy for pretty much all of the three main tick-borne diseases. There are alternative drugs that exist in the case of an allergy to doxycycline, which I will cover, but I do want to make a note that dairy products, if you're a big dairy eater like myself, like milk, cheese, yogurt, as well as iron-rich foods like kale and spinach, can actually affect doxycycline's absorption and reduce its effectiveness in your body. So you always want to make sure that you're spacing these foods out by 2 to 4 hours, preferably closer to 4 hours from when you take your doxycycline, to prevent it from having a reduced effect in your body. Because if that happens, then your disease can worsen, or it can stay in your body for longer than you really want it to be. So for Rocky Mountain spotted fever, doxycycline, kind of as I just mentioned, you'll see that as a pretty common thing, taken twice a day for 10 to 14 days, or a drug called chloramphenicol, which is really only going to be used if you're allergic to doxycycline. There's not great data associated with chloramphenicol. Obviously, doxycycline is the first line treatment for a reason. In this case, it's proven effective. So really, as long as you don't have an allergy, there shouldn't be any reason why you wouldn't be able to take doxycycline. But chloramphenicol has been proven to be effective, just maybe not to the degree of doxycycline. Same thing kind of with ehrlichiosis. Again, doxycycline taken twice a day for 10 to 14 days, or a drug called rifampin, which again is only going to be used if you're really allergic to doxycycline. And lastly, Lyme disease. So all three stages of Lyme disease can be treated with any of the following. Your doctor is likely going to only put you on one of them. Again, doxycycline twice a day for 10 to 14 days, or amoxicillin taken 3 times a day for 2 weeks, or cefuroxime taken twice a day orally for 14 days. So really, in pretty much every case with these diseases, you're looking at a treatment of about 14 days. With this, I want to reiterate too, a lot of the times people will start to feel better maybe 4, 5, 6 days into their treatment with these antibiotics. I really want to stress that you absolutely should finish the course of these antibiotics, even if you feel better, because they're prescribed to you for that long, just to make sure that they kill every last trace of the disease in your body. And kind of stopping these antibiotics abruptly can cause the disease to kind of resurface in your body and even worsen. So just some take-home points I wanted to reiterate. Always try to avoid wooded areas whenever you can, whenever this is going to be feasible for you. Always exercise caution by wearing proper clothing and utilizing repellents whenever you're hiking or working outside for extended periods of time. Always perform a thorough full body examination, especially after spending time outdoors, and especially for any pets that might accompany you outside. And if you happen to find an attached tick, remove it as quickly as possible using the proper method or the proper tools for the job. So this is my references. Again, you're free to use these links. All these links kind of lead to supplemental information. And I have at the bottom more information on that really strange alpha-gal allergy. So thank you so much for tuning in. Again, my name is Evan, and thank you all for showing up.
I think you gave several of us nightmares, Evan. I'm just saying.
Yeah, they're not a fun animal. And I was a scout, so I definitely am familiar with these things. I've pulled quite a few of them off my person. So
Evan, I don't know if you can see it. There is a statement or a question in chat that says, is there any way to distinguish a baby tick from a baby spider?
Yeah, that's a great question. So I'm going to kind of go back for a second here. Baby ticks can be extremely small, up to like, a millimeter or two in size. The biggest way to try to distinguish them is if you're able to get close enough to the tick, you can kind of see here that that they're only going to have they're going to have a more like long body, and the mouth is going to kind of be pretty narrow. Like I might actually just go ahead and Google, like that's a great question, but so you can kind of see here, they do look like spiders, but they have this very large abdomen and they have this kind of long mouth part. And they also are going to usually come in kind of like different colored variations. And if you do happen to find one on your person that's kind of been feeding on you, they may look, again, kind of more nightmare fuel, but they may look like this kind of engorged appearance because they've been feeding and they're full of blood. So this is another kind of great chart that kind of shows you maybe what they look like, kind of, and how small they can get. So it's more just about kind of paying attention to the actual, like looking for that kind of large round abdomen, if that makes sense. Sorry for droning on a minute there, but that was a great question.
There's another question in chat that says, just because a tick has a spot on it, doesn't mean it will carry Lyme disease. Another
great question. No. Just because if you see something like a Lone Star tick or something like that, the Lone Star ticks really aren't, like the Lone Star ticks aren't really the carriers of Lyme disease anyways, but like the black-legged ticks, especially in North Carolina, the good thing is that they attack humans much less frequently than they do in the kind of those northeastern states, and they're also they're not as commonly carriers of infection. So just because you're bitten by one of these ticks does not mean that you would be infected. But as always, if you're worried about that, you can save the tick and you can kind of bring that in and they can analyze it.
Any other questions? You can either unmute or ask or type it in chat. All right, Evan, I see no more questions popping up.
All right. Let me end my share here.